A lot of people, especially school-aged people, spend the summer traveling either with their family or go to summer camp or do summer school somewhere else, and they don't bring their skincare products with them. They forget, they go to a different environment where, their skin is behaving very differently than they're used to. So I get a lot of questions. Well, how can I keep my skin looking okay and not get huge breakouts, especially if I'm trying to do fun stuff and I don't want to be stuck, in the hotel room with a big, huge cyst that's painful. So, it's tricky because a lot of times things that can help balance out your skin, if you really can't get to your products reliably, they would be medications. But a lot of the first-line therapies for acne that really work for the deep cysts are actually photosensitizers, meaning they make you more sensitive to sunburn. Really hard if you're going to go to tennis camp, for 6 weeks. It's not going to work. What I like to do is just tell people to simplify to like the top maybe 2 things that you've used already or that you want to use. If you want to ask me what are 2 things that they can kind of take with them that are small enough to carry on an airplane or just in a bag or something, that they can just have this ideal treatment on the go and in different environments. So the 2 things I really love that really help is one of my products, the Glycolic Pads that I have. They're not really meant to be a cleanser, but they kind of do that if you have any kind of pollutants or oils or something you want to kind of quickly get rid of. It definitely helps with a gentle exfoliation, so you get almost immediately your skin just is looking brighter and better in a really brief swipe, very short period of time. The other would be another one of my products, which is our Retinol that has the Antioxidant Combination formula. So not a retinol that's going to be burning or giving you trouble with irritation, which a lot of retinols that are prescription often do, but something that has a really good kind of balance so that you can use it and you can keep the blackheads and whiteheads away. That's really what it can do really well, and it can keep your pores nice and tight and the skin just looks more smooth. And those are the things that are great for feeling good on your trip or having a good fun summer without making it too complicated, like, oh, I've got to be on this med, I didn't take it and now I forgot, and then you get a bit breakout. This is kind of a super easy, super streamlined way to have some kind of backup. If you're going into getting ready for school, let's say, it's end of the summer, end of August or something, and you're going to be moving, you're going to college, maybe on the East Coast or someplace that's just so different from where you've grown up or where you live, and you're really worried about your acne flaring or it already kind of is not quite managed at that point, then we start talking about kind of adding more of a thorough kind of balanced combination of things. I go into kind of all sorts of different topics with a person, and I really spend a lot of time customizing to that person's needs and their desire. Not everyone wants one thing or the other. So that one is not like, you can't just say okay, here's 2 things you can just, and pretty much anyone can do. There are some great options, like on our website we have this quiz, and you can kind of go through the quiz and get some of I wrote the quiz, so some of my own combinations for certain types of skin or certain types of scenarios that you might be in, certain ages, etc. So if you want a more customized idea, that would be one way to get at least my recommendations. So yeah, otherwise though, there are a lot of cases where you need a jump start with a medication, and that's where I really do recommend seeing a dermatologist. If you have scarring, you have pain, you have ongoing hormonal acne you just can't get rid of, you've had it for years, you're trying to get ready for a wedding, you're trying to go for a job interview or anything, and you just can't seem to do it with products. Yes, there are good products that can help, but it's overwhelming with all the different products out there. But sometimes an oral medication is also the kind of first thing you need, and then you can transition back to topicals. So that would be my approach. There's really only a certain group of foods that we know scientifically can cause acne. The main one is dairy products, and it has to do with the hormones that are in the animal at the time that they are milked, and that gets transferred into our body, and it can affect the skin. It's just kind of straight across hormone change. Truth is, there's so many people who tell me, hey, every time I eat potato chips or chocolate or Kentucky Fried Chicken or something, I'm gonna have a breakout that next day. It's gonna happen for sure. And I believe that. Anecdotally, I totally believe that. And I think that we all do have individual triggers in food that can make that happen. We just don't have science to back it up maybe yet. Maybe someday it will be backed up. But aside from that, just like kind of any inflammatory disease, remember acne is not normal. It's not normal skin, it's a disease, and it's an inflammatory disease. So your whole body is affected by this chronic inflammation, and it really should be reduced. And so if you're eating foods that cause more inflammation, you should stop doing that and find foods that are anti-inflammatory or antioxidant, like fresh fruits and veggies, whole grains rather than processed bread, and a lot of these things you can actually, there's a lot of sources online, honestly, that are pretty decent. I think Cleveland Clinic has some good stuff, Mayo Clinic as well, to look for anti-inflammatory diet. And I have had people who switch over to kind of a more, well-balanced and fresh food kind of diet, and they do a lot better. Their skin kind of starts to clear up without really much in the way of products or certainly no medicine. I mean, there are ways you can do this through food if you really are dedicated and motivated. The hormones play a really huge role in acne for most people, male, female, younger, puberty age people in their 20s, 30s, even actually 50s, 60s. So there's different things that happen at different phases of our life. Puberty is one, menopause is one for women, even throughout the month for women, there's a lot of fluctuations. And men too, men go through major changes in their levels of certain hormones as they age, and certainly puberty is a huge one too. So the tricky part with hormones and acne is from a treatment perspective is that everyone is at a different phase at that moment in time, and I have to kind of carefully decide and work with what could really help this person the best. And sometimes it's a medication, sometimes it's just better diet. It can actually make a big difference for hormones, depending on like what kinds of foods you're eating. If you're eating a lot of meats, red meats and dairy, you're gonna have weird hormone things happen that could make your acne worse. So there are some things we go through and kind of start to look at those details. But yeah, the thing with hormones is that there can be a big change all of a sudden. It's kind of my job to find something that's really gonna try to shut down that inflammatory disease process in the most long-term permanent way I can. And it will require sometimes a combination of treatments. I do actually treat a lot of people with Accutane, or it's now just isotretinoin. It's a very unique medication, and it does cure acne for a lot of people. It's a bit controversial still. I know that a lot of people have opinions about it, which I'm open to hearing about, and I try to answer everyone's questions, but I have seen it really turn people's lives around. Young people, older people, it's a game changer for people. So I do incorporate that into my practice, but at the same time, once they're done with their treatment and they're kind of in a more stable, even hormones aren't gonna play around with their skin too much, we still go to a daily routine, and that really seems to give us the long-term success rate that we're looking for. You can't always control your environment, but if you have a routine that you can do that has worked in the past, and you can just keep it going, kind of like brushing your teeth, you know you're gonna have nice white teeth and you're not gonna have cavities if you do it every day. That's the same with skincare, very similar, I guess I should say, where your skin is going to have, it's just like a security. You're gonna have a higher chance of having long-term success, not get into situations where you get, if it's acne, it's so out of control you have to come to the dermatologist and go on a medication. If you have a daily routine and process that you can rely on, and you could start early. You could start, I have kids coming in at like age 11 or 12 if they're really, some kids are just really mature and they've seen their brother or sister, siblings go through problems. They want to come and just start a routine, and they do well, so yeah, it's really important.